First, we will start the donor examine. Donor is really important for us, you know.
Okay.
Very important. And we will check your donor zone. This is your donor. Look. We are cutting around like this, punch, and taking out, say, 1 gram, but just 3 hair, 3 hair, 3, double. Yeah, your multiple rate is really good, but your hair caliber, hair thickness, looking like a medium, maybe thin. We will measure with micrometer, but
Okay.
they are look like medium, but multiple rate is really good. And the density on the donor looking good. Look. Okay, the color is the blonde and look like thin hair, but there are too much graft each centimeter square. It's good for us to harvesting ability.
Okay. So it's just very thin.
Yeah, it's you maybe you feel very thin, very rare, but I'm checking the how many graft each centimeter square have. How is the density?
Sure.
And the density looking really good.
Okay, that's good.
As skin condition is good, you don't have any dermatologic problem. Also, yeah, you know, very important for healing. I didn't see any clue about the eczema, psoriasis like these dermatitis. You don't have. It's good. The top side here.
It'll be less dense here for sure.
Yeah, they are very thin. Look. And also, maybe you notice that there is the color change around the hair. I will show you. Look, the color change.
Oh yeah.
It means that the hair getting weaker, and most probably they will lose. And some hair on this side looking like a minoxidil hair. Do you use minoxidil?
I do. Yeah.
Yes. And when the people use the minoxidil, like this thin hair, it rising a lot.
Yeah.
But
is that okay?
Yeah, is that good? It can provide us the thick looking the volume, but you know they are not permanent.
Sure.
You can easily understand the color change, the connection between skin and hair. Yeah, your scalp skin not hold the hair tightly. When we pass this side, check the deeply the original hair looking like this.
Yeah, it doesn't have the red.
Doesn't have the redness, and then the connection between skin and hair is tidy. And hair shaft looking oily and bright. But when we pass to here, it's typical medical treatments here. Okay, it's looking good, but they are not permanent. But if you continue, especially for finasteride,
I do both.
You can keep them, and they can provide us the good volume.
Sure.
You know, topical using, like minoxidil, the older topical using, can affect badly the skin long time.
I do the oral.
Yeah, oral. Yeah, no.
Yeah.
But no. Okay. We will check your hair caliber thickness. Oh, it's not too thin.
Okay.
I will measure 3 of them, and we'll take the average thickness, average caliber. How many micron? 4.8 micron. It's good. Normally, human hair thickness change between 3 and 7 micron. That's especially European side, and we are saying medium level 4.5 to 5.5. Yours lower medium, but in medium levels, not too thin.
Yep.
Okay. In this case, like this big job, we need to be careful about the designing the hairline, you know.
Of course.
I know you are young, and maybe you want to do it with small forehead, more hair, but
It's riskier.
yeah, it's risky for the extraction ability and the density, you know. My first strategy to arrange the proportion. There's three part on the face. If the each damn near means the good proportion, I'm measuring the here and then take the half to arrange here.
Okay.
After that, you can, yeah, like this, you can lift up your eyebrow. Yeah, look, the bumble coming here, our limit is here. We cannot put on the muscles the graft.
Oh, I see.
Yeah. I will draw a
Okay.
approximate the line. What do you think?
I think more
More oval.
Yeah.
Okay.
More oval.
I can do it.
Let's see. Sure. Yeah, I like that better.
Yeah.
And then, do you think anything on the temple area?
Yeah. Normally the abdomen has a triangle here. Yeah. And if the triangle disappear, I can do it something to build a new triangle to arrange the proportion. But your triangle is stable, and I think you don't need.
You don't think so?
Yeah.
Okay. Not even like a little
The
bit.
important thing is the proportion. When I do it the frontal area, we can discuss it like this. Okay.
Okay.
Yeah. If when I do it like this, the little bit further, if that part getting back and this side getting further, it can be look strange and it won't be good enough proportion. But
Okay.
you have good enough hair on the temple, it won't be the arrangement that side and here not bad,
Okay.
and you don't need.
All right.
think.
I mean, if you think so, I
Yeah.
trust you. Yeah.
Okay. And also we have the limited graft and need to
Sure.
be careful.
This is the more important
yeah.
spot. Yeah.
With this estimate line, I will measure your recipient area to calculate your need, how many grafts you need, approximately. This is the most important area, frontal zone, you know. There is the your recipient area is a little bit bigger than my expectation because this both side, the left side here looking very big, and I need to do it a little bit wider transplantation for future situation. If they lose, there can be empty zone between the transplanted and existing hair. It's not good for the naturality and looking
Sure.
well designed.
Just to cover everything.
Yeah.
Yeah.
Still recipient area centimeter square, and I will put 45 graft each centimeter square here, 30 graft here, and normally 25 graft needs to put here. But with this distribution, your needs will reach amazing number. 1900 2900. Yeah, this is the total number.
How many total?
How many total? So 6,300 grafts.
Really?
Really big.
Wow.
Now, well, with your case, today we will focus mostly your frontal looking.
Okay.
I will leave the oval crown, like a new losing on the crown, the hair. Yeah.
Sure.
Yeah. This side. And you are using some medical treatment. That medical treatment can can get bigger your crown area hair.
Okay.
And we will see the result after a few years.
Maybe come back and
And then we can take it up a little bit beard side.
Sure.
And the donor zone to cover the whole area and to check your frontal zone condition. Maybe we need to add some graft first operational area to increase density.
Okay.
Okay, I'm
that
sorry
works for
for
me.
this. It's maybe you came here for
just-
one session, but it's to turn the two session. But
Yeah.
you know, this is
I
the
didn't think it would
reality.
be this many.
Yeah, I can do it. Maybe a little bit small than here, and then I can use a little bit less graft, but I'm sure there will be some border between your existing and transplant hair, and it will look very strange border and needs to complete the connection.
Okay. Yeah, let's cover everything.
Yeah.
Yeah. That's fine.
We will focus to frontal and mid side looking, especially frontal looking today.
Okay.
And we'll see the result. Okay.
Okay, that works. So do all of the. So we wouldn't do this?
Yeah. I'm sorry.
Take that out.
Yeah. I will do like this leave the oval zone, like new losing area, starting to losing from the crown. We will solve the front and mid.
Okay, I like it.
Okay.
You need chicken?
You know, we draw a line during the examination, but it was just roughly and estimate line to see your needs. We will draw again. It will be very near, but there will be enough balance, and then your head form is really symmetric. Normally, I measured when I measured the both sides, it's looking very unbalanced, but there is enough balance.
Okay.
But I will arrange again, and then we'll give a mirror to check all detail. Can you lift up your eyebrow? No. And relax. Do it again, please. Okay, relax. Mid is here. And this side going well. You want a little bit oval. Just. Yeah, you can take the mirror. It's your line.
Yeah.
Yeah. Can you lift up your eyebrow again? Look, there is bumble here.
All right.
It's almost border. I cannot do it too much down.
No, that
I
makes
cannot. Yeah. And there is enough symmetry.
Yeah.
we will use a little bit wider line like this. Okay, you have some hair, but when we shave, you understand easy.
Yep.
That side hair is very thick. It can be border, and we still use a little bit wider to connection. And I will leave the like this oval zone on the crown to look natural.
Okay.
Okay. What do you think?
I like it. Yeah, that's pretty much what I was expecting.
Okay.
So.
There can be slightly the differences between both sides because every head form
It's
is different.
Sure.
But it's very near. And also I will do some micro-irregulation, random irregulation for the natural looking like a zigzag.
Okay.
Feel good.
No, I'm good with this. I like it.
And the worst part, I'm sorry for this, I need to do the local anesthesia.
Okay.
Yeah, maybe some clinic they are using the sedation. Okay, I have a anesthesia team because this is hospital, This is anesthesia, all things I can sleep you, but I don't want. I like the local anesthesia. It's awake patient is every time better. I'm sorry for this. Wow, you are amazing. Don't have any pain?
A little bit.
Really? There isn't any crying. Okay. Wow, it was very fast local anesthetic part. Our patient today has really good patience. Okay, thank you. This is your PRP. Did you heard anything about the PRP?
No.
No, it's just your blood. We centrifugated your blood and then share the platelet rich plasma, platelet area.
Okay.
I will inject this plasma on your scalp, under the skin. It will help your healing process. Okay.
Okay.
Do you feel any pain?
No, I feel the needle a little bit, but
Yeah,
it's not bad.
Well, how about here?
More in the front, I feel
More
it.
front.
Yeah.
Okay. Yeah, it needs to do a bit more injection for front. This process, the hair transplantation will take for you 8, maybe 9, maybe 10 hours.
Okay.
And if you feel the pain,
I don't
you
want
cannot handle it during the 8, 9 hours. You need to say, okay. How about now?
It's okay. That's good.
I'm starting the opening hole process. The opening hole means the channel process. It will determine the hair angle and hair direction and distribution, how many graft, which area, and how direction, how angle. After my channel, my team will implant your graft inside my channel with Yaman implanter, like DHI implanter. I created that implanter like this process. Normally the normal Choi implanter has a sharp cutting edge and it's open its self channel and then putting the graft inside, but I will observe something that the graft getting that they are putting the graft a little bit high angle and it's growing to the sky. And I thought that if they arranged a very small channel with really good angle and direction, after then they inject the graft inside can be better for the natural looking. And our plan working like this, I'm arranging the hair density, how many graft, which area, how angle, and how direction.
Yeah.
After then we are doing the implantation process. Okay.
Okay.
First I did your line, you know, line can be clean. Then it looks really good. Your healing process going well. There isn't any darkness, any less blood circulation like a ischemic area. It's the skin almost covered around. Looks really good. Your frontal zone is good density, and then density getting a little bit less to the crown.
Sure.
And your donor looks good. You can be worried. It's look maybe too much harvesting, but don't worry.
Okay.
Your hair is thin, and your hair density on the donor was really too much. That extraction won't be visible because your donor density was really good.
Okay.
Okay. Look at this process. You come here. Look. There is good enough micro-irregulation, and then line is the proper, the head form, and healing looking really good. Just 1 day passed, and then it's looked like 5 days job. And I want to show the donor zone. Look, especially around the ears, we extract a little bit less graft for each centimeter square, and for this part, you know, this frontal looking area and the density mostly is a little bit less for the temple side, and we are extracting a little bit less graft each centimeter square from here. And occipital zone has really good density, and we extracted, harvested a little bit more graft from the occipital zone, and there isn't the sharp line for the extractional area. It's getting slightly, and there won't be visible opened area on your donor. It's
Awesome.
looking really good.
Awesome.
I like it.
I'm happy so far.
Okay.